published in 1845, Wilhelm Griesinger's Die Pathologie und Therapie der psychischen Krankheiten, The Pathology and Therapy of Mental Illnesses, stands as a monumental pivot point in the history of psychiatry. It effectively founded the era of biological psychiatry in Germany, challenging the metaphysical and philosophical speculations that had long dominated the field. Griesinger's core, revolutionary thesis was his famous first-line assertion: mental illnesses are brain diseases. He argued that all psychological disorders must ultimately have a somatic, physical, origin in the pathology of the brain and nervous system. This was not a reductionist claim denying psychological experience, but rather a directive for scientific methodology. He insisted that the study of mental life and behavior must be grounded in the anatomy, physiology, and pathology of the brain. The book is systematically structured in 3 parts. First, it lays out the general pathology of mental illness, establishing his somatic framework. The second and most extensive part details the specific pathologies of various mental disorders. Here, Griesinger moved away from rigid categorical systems, instead proposing a more fluid, longitudinal model. He famously suggested that many disorders progressed through recognizable stages: depression, melancholia, agitation, confusion, and finally dementia. A concept reflecting the chronic, deteriorating course he often observed in asylum patients of the era. Griesinger's dictum that mental life must be studied through the brain created a crucial demand for a new science, psychophysics. Pioneered by contemporaries like Gustav Fechner and Ernst Heinrich Weber, psychophysics sought to establish precise, quantitative laws governing the relationship between physical stimuli, the physics, and subjective sensation, the psyche. For Griesinger's followers, this methodology was the perfect tool.